Welcome back. Thank you for staying with KTN Prime. Health Cabinet Secretary James Macharia has defended the controversial 41.5 billion shilling medical equipment project, saying that it was driven by public demand. Macharia denies that the initiative was prompted by governors. The project has sparked controversy, with the Council of Governors accusing the Ministry of insincerity and withholding critical information about the contract. Patrick Amimo has more.
A level 5 in every county.
A joint Senate Committee on Finance, Commerce and Budget is now investigating the controversial medical equipment project that is targeting level 5 hospitals in each of the 47 counties and level 4 hospitals in every sub-county. National referral hospitals will also benefit from the project. The project will cost $432.4 million US.
We require 41 billion shillings, 465,808,000 at today's exchange rates.
The popular assumption has been that the medical equipment was leased by the national government, but the Cabinet Secretary dismissed that notion, saying a team of consultants and procurement experts agreed on a managed equipment services model in order to allow hospitals focus on the core mandate of providing clinical services. That arrangement appeared confusing to senators, and even the health officials could not explain it satisfactorily.
This is not a purchase, it's not a loan, it's not a lease, because there has been a sort of misconception that we are actually leasing this equipment. We are not.
So the question is, what is it? It has a clause here that simply means that you have transferred an obligation to counties on this equipment, which would not otherwise be if it was a lease.
We are really concerned that under this arrangement you are going into, which is not a lease, it is something else, I still don't understand exactly what it is.
They are calling it managed equipment service. So why are you unable to use that term?
Our view is that it is lease financing, and that is what the literature suggests to us when we evaluated it.
I'm sure somebody signed a contract somewhere.
Yes.
What does that contract say? Is it a lease finance, or does it have some other terminology? Have you ever seen it?
No, I haven't seen the document, Chair.
So what are you speaking? You are speaking from what point of information?
I am speaking from the original documents, the MOUs that were signed.
Forget about MOU. Have you seen any document signed between the manufacturers and the government of the Republic of Kenya?
No, Chair.
So then your information is just a rumor.
Kakamega Senator Boni Khalwale argued the project was overpriced and a rip-off. Khalwale says an expert analysis of the project shows an outright purchase of equipment would have saved each county 585 million shillings.
If they are allowed to purchase outright and still hire that service contract, they'll need only 223 million in 7 years. Tell us, who is pocketing the 585 million shillings, 808 minus 223? That is the scandal.
If we are to buy the equipment, how much would it cost us? There's a document which was done by independent consultants. So those figures, I would like to commit to this committee that they are not credible.
Despite the confusion surrounding the managed equipment service arrangement model, the Cabinet Secretary for Health insists that the procurement process was done above board. Patrick Amimo, KTN, Nairobi.